Now, India is kickstarting the second phase of the vaccination drive from today, with the private sector also participating and scaling it up. Ruchi caught up with the vaccination task force head and the principal scientific advisor, Professor Vijayaraghavan, and asked him about the government's preparedness and how the drive is all set to kick off. Listen in.
This second phase is very, very important because it learns from the rollout in the first phase, which was for healthcare workers and frontline workers. The second phase is for people with morbidities, comorbidities, and for elderly people. So people above 45 are being targeted. And this accounts for a significant fraction of those who need to be vaccinated. Fundamentally, it also accounts for a significant fraction of the people who will be in our workforce or who are susceptible. Therefore, it's critically important that this second phase go fast and well, and that's what the government has done. It has roped in an entire network of people, both within the government system and the private system, and This exponential scaling up of the vaccine will have an enormous impact.
Absolutely. And, we're also hoping that the numbers also rise significantly. Having said that, what kind of targets are you, putting out as far as the second phase of vaccination is concerned? In the first phase, we had said that we're looking to inoculate as many as 30 crore people in, by the end of July, August. So talk to us about the numbers that we're really looking at as we kickstart the second phase as well.
Remember the second phase involves a very large fraction of people, which, as you said, needs to be done rapidly. Now, the challenge here is the following. It's not so much about how many we vaccinate a day beginning today or tomorrow and so on. It's the rate of change of this extent of vaccination. How many more people are we vaccinating every day? And that is going to, impact several hundred crores as we go ahead. And therefore, the speed of vaccination will change dramatically, and it will change for a simple reason. One, from the supply side, you're going to have more and more vaccines available, more of the ones we have now, and more new vaccines available. Right. Supply side over the next month, 2 months, 3 months will be less and less limiting in any way. The second is that the distribution side is going to become much more involved in terms of multiple kinds of agencies involved. And it will be user-friendly, as it has already been in place, but user-friendly on scale. You can choose where you want to go and get vaccinated, what time, what day, and get it done in a very simple manner. These two factors, the distribution system and the user-friendliness, along with the supply side, will make a dramatic change. And we will see, increased vaccination at a much higher pace.
Before I talk about, of course, the rising number of COVID cases and mutant strains as well, I want to understand from you, what are the lessons that the government and the entire administrative machinery have learned from the first phase of the COVID vaccination drive as we're stepping into the second phase now?
Let me address this point you mentioned about mutations. Mutations occur in the virus as it, traverses the globe. And really, by and large, they are just a time and space stamp of where they've been. They tell you the lineage of the virus. Now, supposing these mutations accumulate to change the properties of the virus slightly, then they become variants of concern. And should those mutations change the properties very substantially, then they become new strains. SARS-CoV-2, for example, is a new strain compared to SARS-CoV-1. But it's closely related. Right. So these are the ways the mutations accumulate. Right now, the variants of concern are such that some of them are slipping past our immune response or vaccines. So that is not a switch.
All right, that's the view coming in with respect to the COVID vaccination from the principal scientific advisor.